Hi, I'm Colleen Ramirez. I'm the Chief Administration Officer at Bone and Joint Surgery Center of Novi. We started using Simple Admit last July in 2016.
My name is Amanda Kelly. I'm from Hyde Park Surgery Center in Austin, Texas. We've been using Simple Admit for about a year and a half now.
Hi, my name is Jen Bloxam, and I'm from Millennium Surgery Center in Meridian, Idaho. We started using Simple Admit about 1.5 years ago.
Hello, my name is Shelley Longgood, and I am the director at the Edmonds Center for Outpatient Surgery in Edmonds, Washington. Roughly a year ago, we were fortunate to be able to implement Simple Admit. The folks from Simple Admit were fantastic. They carried us through the procedure from start to finish, extremely supportive, and I just can't say enough good things about the company itself.
I've been the administrator of North Texas Surgery Center down in South Dallas for 15 years now. I was very excited about the idea of complementing the work that our staff does, and this goes in line with moving forward and increasing patient access and making things easier for the offices and such.
The benefits for us is it's decreasing the time our pre-op nurses are on the telephone trying to get that health history information. It significantly helps our facility and decrease the stress level, I feel, of our PAT nurse. It allows them to spend more time with the patients during the day.
We do about 350 patients a month, of which probably about 70% use Simple Admit without any prompting from us, just the instructions from the physician's offices. I can't imagine going back to the old way prior to Simple Admit. That would entail reaching out to every single patient individually, and with 350 patients, I absolutely could not do that with one single nurse, which is what I have in my patient access department. It just wouldn't be possible for us to do that. And the cost would be so absorbently high, it would be ridiculous to even incur those costs.
One of the biggest changes it's made is the streamlining of how we have patients go online to fill out their health surveys. It saves us time, as we were before using a paper chart to call every single patient. So we've increased our efficiencies.
And what a joy is it to just click on the patient's name through Simple Admit and see that that patient has filled out their own simple admission questionnaire.
Implementing Simple Admit has given the nurses directly the opportunity to be able to do things more thoroughly versus rushing through that medical history screening.
The cost benefit is really quite huge. If you think about a nurse talking on the phone with a patient for sometimes 30 to 40 minutes, and that time could be spent with patients. It's a great financial tool for us.
And now we have a higher rate of people going online, which, as everyone knows, decreases payroll and decreases the time nurses are spending ahead of time calling patients. So
I feel just the ability that patients can do it around the clock. You don't have to be talking to a pre-op nurse at 8 o'clock in the morning to 1 o'clock in the afternoon. It actually helps get that information to the facilities faster.
The biggest difference before and after using Simple Admit at Mississippi Valley Surgery Center was the opportunity for the patient to be able to do their pre-registration and their medical history screening at their convenience at their time. Being a Monday through Friday, 8 to 5 operation, it's difficult for the nurses to be able to get a hold of those patients, so constant phone tag, so more inconvenience for the patient than anything, and so giving them that opportunity to do that, we now have over a third of our patients doing it when they want to do it.
The nice thing about this is it has two very important parts. One is that the patient has the access 24/7 online. They can do it at the ease of their time schedule, but also there are the options of languages, and we're becoming more and more multicultural, and this is a very nice feature that people feel comfortable with.
one of the things that I was asked a lot from other administrators was, how did this affect the nursing transition? How hard was it to train the nurses on site? How hard is it to use the software? the word hard should be removed from that question. There's absolutely nothing hard about it. They are easy to work with. They are concise and so pleasant. And our nurses, I can train someone in under 20 minutes. So it is an incredibly easy software system and platform to train on. It's easy.
It is very easy to use. I personally train our employees, our nurses who go on to Simple Admit for their initial orientation, and it literally requires less than 1 hour before they feel total comfort and ease with using that site.
I've had the opportunity to represent Simple Admit as a current client to other centers and to be able to explain to them exactly how beneficial it is to our staff from taking on additional responsibilities or just giving them the extra time to be more thorough. And the biggest advantage is the service to the patients, being able to do all of their health screenings and pre-registration information online at their convenience, 24/7.